One of the most common requests we get these days is for more booty, which I find really ironic considering that most of my life, at least I remember growing up, people wanted less booty. But there are procedures available today that will give you more of a rear end, a little bit more junk in the trunk if you like, and the one that I favor is the Brazilian butt lift. For years people were trying to make buttock implants work well. Unfortunately, that operation seems to be plagued with a bunch of really complicated problems. So nowadays, most people who are doing buttock augmentation are using the patient's own fat. It's known as autologous fat transfer. For my patients, I typically take fat away from the flank area, that is the small of the back and on the sides of the lower back, and process it on a back table, and then I re-inject it directly into the buttock proper in the area where the patient wants more fullness. We think that at least 50% of the fat that we transfer seems to stick, seems to survive, and most patients do very well. So we're looking now at a woman who came in asking for a buttock augmentation, and so I did exactly what I just described. There was some fat taken away from these areas here on both sides and then injected directly into the buttock here where she wanted more fullness. From the profile view, you can see that she certainly wears her jeans a little bit nicer, they're a little fuller, and she's got a little more backside in the after photo. Also, of course, as an oh by the way, she doesn't have as much fullness in the flank area, which she hated so much before. So overall, I find this to be a really nice procedure, and rather than taking fat away and discarding it as we do with straightforward liposuction, we are just sort of shifting it. We're moving it from one place and inserting it into another to try to make patients more shapely, to try to give them the contour that they're looking for. So the Brazilian butt lift is a very simple procedure. It's easy to do. It's well tolerated under local anesthetic, and I find it to be one of the most requested procedures that I do these days.